I think one of the reasons that I was really drawn to Michigan to come here for my surgical residency was the dedication that I saw in a away rotation I did here, but also during the interview day and kind of spending some time here in the department about the real dedication to the development of residents, not only as technically skilled surgeons, but also as clinicians who are very compassionate for their patients, but also these impactful researchers that are going to go on and change the surgical field. And it's that kind of composite surgeon or person really that really attracted me to come to this program. The Michigan Promise, which you'll see basically on everyone's slides, either in the bottom or is a big highlight, is one of the things that we use to help us develop both attendings and residents. And we're very, very dedicated to that. My personal role in the resident version of Michigan Life is that I'm the achievement chair, which means I focus on making sure everybody is developing appropriate for their year and making sure we have the appropriate programs in place to have every single resident achieve their full potential and even beyond that. So we mentioned these launch teams. This is a program that we like to start an intern year. So you walk in the door and we'll start giving you a launch team, which is a collection of mentors that will help you achieve your full potential. So the goals are threefold. We want you to have a formalized mentorship team that knows you, knows your goals, and knows everything about you to make you the best that you can be once you're done with training and even beyond. This will basically be a cohort of mentors that will continue throughout your career, probably for most of us, and kind of propel you forward. We want this kind of mentorship team also to be those folks, because they know you so well, they're going to be the ones that help represent you and give you some transparency in all of your evaluations. Because if you read anything nowadays, residents always want more evaluations from their attendings, and they want kind of strong feedback to figure out where to go from here. And this launch team helps you get that. Then the last thing that we think is really, really important with these launch teams is that residents can reflect on their experiences. So I'm sure you all have experienced this, especially in surgery, but it is a very fast-paced world. And sometimes when you're kind of going through clinical rotations, it's really hard to reflect on the experiences that you're having, even those experiences are completely changing you as a person. So this is an opportunity to have our residents really reflect on how they experience becoming a surgeon and how that's going to impact them later on. So just to kind of describe the overall structure of what this launch team looks like, is everybody gets a launch team in their intern year, and this launch team is very flexible, but it will come with you from intern year to your chief year and beyond into graduation. Ideally, at the end of your time here, your launch team is somewhere between 5 and 6 people, but it does start with 1 to 2 people, mentors. So again, it's flexible. It can change over time if your interests change, and it's really meant to benefit you. And if it's not doing that, then we change it. But there is structure involved. So once you walk in the door, you're our intern, you get assigned 1 or 2 attendings, faculty members, mentors, based on your personal preferences that will elicit and your career aspirations. And you don't need to know completely when you get here, but we'll kind of find the people that are right for you and right mentorship opportunities for you. And then every year we ask residents to think about what their career aspirations are, you know, whether it be research or whether it be clinical, and you're encouraged to add a mentor to your team to make sure that you continue to grow and nothing becomes stagnant. So this team, this launch team of mentors, will be with you in your first 3 years of clinical time, transition into your research years for 2 years, and come back with you for clinical time for another 2 years. And the point of that is to create this core set of individuals who knows you, knows your entire course and the changes that you've made throughout your time, and can help direct you kind of in the pathway you want to go. Ideally, so these launch teams that are structured will meet about 3 times a year. The goal is to make sure there's connection and make sure we identify residents who either need some extra help in figuring out getting through the year or finding weaknesses to improve, and also pushing those residents who are excelling and making sure that you're being challenged appropriately. So every meeting is structured to your year, so your PGY level. So interns and let's say PGY 6s will have different structures, and it's based on the time of year. And there's a little bit of pre-work that residents require to help improve that self-reflection. So usually the first meeting is to create your annual goals, to make sure you know that you're supposed to be excelling this year and what you're supposed to be focusing on. The second meeting is to really evaluate how it's going, to talk about how attendings and your co-residents are perceiving you that year, and kind of identify struggles, weaknesses, strengths, and how to build on those things. And then here's when we start talking about adding another mentor to make sure that the resident continues to grow. And then in the third meeting, again, we review some resident evaluations to see if we've made any improvements, to see if there's anything else we need to work on. And then ideally, this is another time where residents take the time to focus on what happened this year. What kind of surgeon am I becoming? Am I getting out what I want to? Are there things I need to still work on? So this is a very busy slide. This is basically what our curriculum looks like for our PGY 1 through 7 years. I won't bore you with all the details, just to pull out what interns are really focused on in their first year for their launch teams. So for the first meeting, we're really just trying to figure out who you are. Your mentors want to learn who you are, what your goals are, etc. Intern year is a hard year, and if you don't kind of set goals in the beginning, you can kind of get away from you. So meeting 2, you focus on you reading your evaluations, kind of interpreting them together. What do they mean and what can you change? And of course, one of the things we really want to talk about is your work-life balance and how things are going, because we're not just surgeons, right? We're people. Some of us are spouses, some of us are parents, some, we're daughters, we're sons, etc. So we're not just surgeons, we're not just in the hospital. There's more than that to us. So we discuss kind of work-life balance here, and again, add a mentor. And then at the end of your intern year, of course, we'll talk about evaluations again. How did the year go? What can we do differently? How is PGY 2 going to be different? What are my goals for that? And I just wanted to give everyone kind of a concrete example of what a launch team looks like, because it sounds great, but sometimes you just need an example. So this is my launch team. I, again, am in my 5th year. So I'm in my 2nd year of research, or ADT time, and I have 2 more clinical years to go. My personal interest is I want to be a colorectal surgeon, and I focus on quality improvement research and surgical education research. And this is my team that helps me do that. So Dr. Regenbogen, he's a colorectal surgeon here. He is an expert in the health sciences. He works at CHOP. Dr. Hendren is also a colorectal surgeon. She specializes in quality improvement research, so she helps me kind of create projects and learn how to do that. Dr. Swanable is a colorectal surgeon here at the VA. She specializes actually in qualitative research. So her and I work a lot together on things like surgery identity, the hidden curriculum, things like that. Dr. Mazer here is a surgeon in minimally invasive, who we don't have a clinical focus that is related, but she has a master's in professional health education, which I really care about. So I get her expertise on educational objectives. Dr. Mary Burns is a PhD sociologist here. She is an expert qualitative researcher, and I've learned anything I know about qualitative research from her, and she helps me with my methodology, which has been really important in my world. And then obviously Dr. Gurjit Sandhu, who's here on the call with us, she is our Vice Chair of Resident Professional Development, and she helps me kind of create programs like this that we can help make sure we're developing our residents appropriately, and help me learn kind of the nuances of surgery resident education. So this is a group of individuals that, wouldn't always meet in the same room without me, but because of my interest all combining with these folks, we meet together, and it's been really, really valuable to kind of develop me as a researcher and a surgeon. So it's been a super successful program for me. I'm really passionate about this team that I've built for myself. It's great. It's helped me move forward for sure.